point in MS research where we're hitting some stumbling blocks, and a lot of those stumbling blocks are related to how well and how precisely we can measure phenotype in MS. And the reason that's important is our next frontier is treating progressive MS. And what that requires is finding things that let us know what's happening at the biological level so that we can screen drugs faster. We can't afford to have 3 to 5 year clinical trials to use our standard clinical exams as outcomes. Things will happen too slowly for patients. So we can use all sorts of big data sources, whether it's the rich imaging data we get on patients when they go in the MRI scanner, whether it's wearable sensors or, according to our new speaker, invisible biosensing. So we can use technology to give us the sensitivity we've been missing. So the majority of sensors that have been published on so far involve using accelerometers. These are things that in the commercial setting are used to provide step counts and activity levels, and we've seen several publications demonstrate that we can measure with some sensitivity differences in physical activity that are associated with our standard outcomes in MS. Now what we're seeing is use of other sensors, gyroscopes, surface EMG signals, and figuring out how to combine those sensor signals to give us even more information. The invisible sensor that was presented today gives an additional type of data that doesn't even require much patient participation. One of the issues with the devices is they do have to be charged. They usually are worn for about 8 hours a day. What was proposed today would be an option for full day and night monitoring that is minimally obtrusive to patient life. So these devices are making their way into clinical trials. They are included as outcomes from some of the most recent trials that were initiated for the last few years. I think when we think about using this technology, there's a number of things. Some of them may go through clinical trials before coming to practice. Others, if they show great and immediate benefit for the clinical setting, could go straight into clinical practice. All of them need to be verified for their sensitivity to change over time. This is the key, is sensitivity to change over time. A lot of things can be associated in cross-section with MS disability, but the key is what is sensitive to change over time so that we can detect treatment effects or side effects.